Anal sex carries different medical risks than vaginal sex primarily because the anatomy and biological functions of these areas are fundamentally different. From a medical perspective, the vagina is a muscular canal designed for penetration, childbirth, and sexual activity. It has elastic walls, a natural ability to stretch, and self-lubricating glands that reduce friction and protect the tissue during intercourse. The anus and rectum, however, are designed for an entirely different purpose: the controlled passage of waste. This difference alone explains why the risks associated with anal sex are not the same and why additional precautions are medically important. The lining of the rectum is thinner and more fragile than vaginal tissue. It is not built to withstand repeated friction, which makes it more susceptible to micro-tears. These tiny injuries may not cause immediate pain or visible bleeding, but they can create entry points for bacteria and viruses. This is one of the reasons why the risk of sexually transmitted infections is higher with anal sex, especially when protection is not used. The rectal tissue also absorbs fluids more easily, which further increases vulnerability to infections. Another anatomical factor is the anal sphincter muscles. These muscles are designed to remain tightly closed to maintain continence. Forced or rushed penetration can strain these muscles, potentially leading to pain, spasms, or long-term weakening. Over time, repeated injury or excessive pressure may contribute to issues such as chronic discomfort or reduced muscle control. Unlike the vagina, which can relax and expand more naturally during arousal, the anus requires deliberate relaxation and gradual adjustment to reduce the risk of injury. Lubrication is another major difference. The vagina naturally produces lubrication in response to arousal, which protects tissue and reduces friction. The anus does not have this ability. Without sufficient external lubrication, friction increases dramatically, raising the likelihood of tissue damage, irritation, and inflammation. From a medical standpoint, adequate lubrication is not optional in anal sex. It is a basic safety requirement. There is also a difference in bacterial environment. The rectum contains bacteria that are normal and harmless in that area but can cause infections if transferred to other parts of the body. This is why healthcare professionals emphasize hygiene and the importance of avoiding cross-contact. Understanding this aspect of anatomy helps reduce complications such as urinary or vaginal infections. Pain is another critical consideration. Vaginal discomfort during sex can sometimes be mild and temporary, but anal pain is a more serious warning sign. Because the tissues are delicate, pain often indicates excessive pressure, lack of lubrication, or muscle resistance. Ignoring pain increases the risk of tearing and inflammation. Medically, pain should always signal the need to stop and reassess. In summary, the medical risks of anal sex differ from vaginal sex because the body structures involved are not designed in the same way. Thinner tissue, lack of natural lubrication, tightly controlled muscles, and a different bacterial environment all contribute to increased vulnerability. Understanding these anatomical realities allows individuals to make informed decisions, take appropriate precautions, and prioritize long-term sexual health rather than relying on assumptions that all forms of intercourse affect the body in the same way. Understanding anatomy helps reduce injury and infections because the body responds predictably to pressure, friction, and stress when its natural design is respected. From a medical point of view, many sexual injuries occur not because of the act itself, but because people misunderstand how certain parts of the body function. When anatomy is ignored, actions may exceed what tissues and muscles can safely tolerate, increasing the risk of damage and infection. The anus and rectum are lined with delicate tissue that is thinner and less elastic than vaginal tissue. This lining is efficient at absorbing substances, which is useful for the body's normal functions but problematic when it comes to exposure to bacteria and viruses. When this tissue is stretched or irritated without proper care, microscopic tears can form. These small breaks in the skin are often painless at first, but they provide direct pathways for infections to enter the bloodstream. Knowing this anatomical fact emphasizes why gentleness, lubrication, and protection are medically important rather than optional. Muscle structure also plays a major role. The anal sphincter is composed of muscles designed to stay closed most of the time. These muscles protect the body by controlling bowel movements, not by allowing penetration. Sudden or forceful pressure can trigger a natural defensive tightening, increasing discomfort and the likelihood of injury. Understanding that these muscles require time and relaxation helps prevent strain, spasms, and long-term muscle weakness. When the body is rushed, it reacts with resistance. When it is respected, it adapts more safely. Another anatomical consideration is blood supply. The rectal area has a rich network of blood vessels close to the surface. While this allows for healing, it also means that any tears or irritation can bleed more easily and may take longer to fully recover if repeatedly stressed. This is why repeated friction, without adequate preparation, can lead to chronic soreness or inflammation. Recognizing this vulnerability encourages people to prioritize rest and recovery instead of repeated strain. The bacterial environment is equally important. The rectum naturally contains bacteria that are harmless within that space but can cause infections if transferred elsewhere. Understanding this helps reduce risks by encouraging appropriate hygiene practices and avoiding behaviors that spread bacteria to other sensitive areas. Over-cleaning, however, can damage protective tissue and disrupt natural balance, which shows that anatomical knowledge supports moderation rather than extremes. Anatomy also explains why pain should never be ignored. Pain is the body's protective alarm system. In areas with sensitive nerve endings, such as the anus, pain often indicates excessive pressure, tearing, or inadequate lubrication. Continuing despite pain increases the chance of injury and infection. When individuals understand this biological warning system, they are more likely to stop, adjust, and prevent lasting harm. Infections are not random events. They occur when barriers are compromised. Healthy tissue acts as a protective shield against bacteria and viruses. When anatomy is respected through gentle techniques, proper lubrication, and protective measures, this barrier remains intact. When it is damaged even slightly, the risk of infection rises sharply. Ultimately, understanding anatomy shifts sexual health from guesswork to informed care. It empowers individuals to recognize limits, respect natural structures, and make decisions that protect long-term well-being. Medical safety is not about fear or restriction, but about working with the body rather than against it, reducing preventable injuries and infections through knowledge and awareness. Proper lubrication is essential for safety and comfort because it directly reduces friction, protects delicate tissues, and lowers the risk of injury during sexual activity. From a medical perspective, friction is one of the primary causes of tissue damage. When skin or internal lining is repeatedly rubbed without adequate moisture, it becomes irritated, inflamed, and more prone to microscopic tears. These tears may not always be visible or immediately painful, but they significantly increase the risk of bleeding, soreness, and infection. Unlike some parts of the body that naturally produce lubrication in response to arousal, the anal area does not have this ability. The tissue in this region is thin and sensitive, and it is not designed to handle dry or forceful contact. Without added lubrication, even slow movements can create enough friction to damage the lining. Understanding this biological limitation makes it clear that lubrication is not an optional enhancement, but a basic safety requirement. Adequate lubrication allows movement to occur smoothly rather than with resistance. This smoothness reduces pressure on the tissue and helps the muscles relax instead of tightening defensively. When muscles sense excessive friction or discomfort, they naturally contract, which increases pain and the likelihood of injury. By minimizing friction, lubrication supports natural relaxation and improves overall comfort. Another important medical benefit of lubrication is its role in reducing inflammation. Dry friction can irritate nerve endings and blood vessels near the surface, leading to swelling and tenderness. Repeated irritation without lubrication can cause chronic soreness or sensitivity that persists even after the activity has ended. Proper lubrication helps maintain the integrity of the tissue, allowing it to recover more quickly and remain healthy over time. Lubrication also plays a role in infection prevention. When tissue remains intact, it serves as a strong protective barrier against bacteria and viruses. Microtears caused by dryness create entry points for harmful microorganisms. This is especially important in areas where the lining absorbs substances easily. By reducing the chance of tissue damage, lubrication indirectly lowers the risk of infections, including sexually transmitted infections. The quantity of lubrication matters as much as its presence. Using too little can be almost as harmful as using none at all. Friction can increase as lubrication dries or absorbs, so reapplication may be necessary. From a medical standpoint, maintaining consistent lubrication throughout activity is key to ongoing protection and comfort. Comfort is not just about physical sensation, it also affects psychological relaxation. When discomfort or dryness is present, the body remains tense and alert, increasing the risk of injury. Proper lubrication creates a sense of ease, allowing the body to respond calmly rather than defensively. This mind-body connection is important in preventing sudden movements or muscle tightening that can cause harm. It is also important to recognize that pain caused by inadequate lubrication should never be ignored. Pain is a signal that the tissue is under stress. Continuing despite discomfort increases the likelihood of tears, inflammation, and prolonged recovery. Medically, stopping to add more lubrication is a protective and responsible response. In summary, proper lubrication supports safety by reducing friction, protecting delicate tissue, minimizing inflammation, and lowering infection risk. It enhances comfort by allowing smoother movement, encouraging muscle relaxation, and supporting the body's natural protective responses. When lubrication is treated as an essential component rather than an afterthought, the risk of preventable injury decreases significantly, and overall sexual health is better preserved. Gradual preparation reduces tearing and muscle strain because the body needs time to adapt to pressure and stretching, especially in areas that are naturally designed to remain closed. From a medical perspective, sudden or forceful penetration places excessive stress on tissues and muscles that are not prepared to accommodate it. This stress is one of the leading causes of injury, pain, and long-term discomfort. The muscles involved in anal control are strong, responsive, and protective by nature. Their primary function is to maintain continence, which means they automatically tighten when they sense pressure or threat. When penetration is rushed, these muscles often contract rather than relax. This resistance increases friction and pressure on the surrounding tissue, raising the likelihood of muscle strain and small tears in the lining. Gradual preparation allows these muscles time to relax naturally, reducing defensive tightening and lowering injury risk. Tearing is often the result of forcing tissue beyond its current capacity. The lining of the rectum is thin and sensitive, and it does not stretch as easily as vaginal tissue. When pressure is applied slowly and progressively, the tissue has time to adjust and distribute that pressure more evenly. This reduces localized stress points that lead to microtears. These small tears may not cause immediate symptoms, but they can result in soreness, bleeding, and increased vulnerability to infections. Another medical benefit of gradual preparation is improved blood flow. Slow stimulation encourages circulation in the area, which helps tissues become more flexible and resilient. Increased blood flow also supports healing and reduces the likelihood of inflammation. When the body is rushed, this natural physiological response is bypassed, leaving tissues more rigid and prone to damage. Muscle strain is another concern that is often underestimated. Just like any other muscle in the body, the anal sphincter can be strained if it is forced to stretch too quickly or too far. Strained muscles may become sore, tight, or spastic, leading to discomfort that can last for days or longer. In some cases, repeated strain without proper recovery may contribute to long-term issues such as chronic pain or reduced muscle control. Gradual preparation minimizes this risk by allowing muscles to lengthen and relax at a safe pace. Pain is an important signal during this process. From a medical standpoint, pain indicates that tissue or muscle is under stress. Gradual preparation helps distinguish between mild pressure, which may be manageable, and true pain, which signals the need to stop. Ignoring pain increases the chance of tearing and muscle injury. Listening to the body and proceeding slowly is a key protective strategy. Psychological relaxation also plays a role. When the body anticipates pain or discomfort, muscles naturally tense. Gradual preparation reduces anxiety and allows both the mind and body to remain calm. This relaxation further decreases muscle resistance and supports safer movement. The connection between mental comfort and physical response is well recognized in medicine and should not be overlooked. Infections are another indirect concern. Tears caused by rushing create openings in the protective tissue barrier. These openings allow bacteria and viruses easier access to the bloodstream. By reducing tearing through gradual preparation, the body's natural defenses remain intact, lowering infection risk. In summary, gradual preparation supports safety by allowing muscles to relax, tissues to adapt, blood flow to increase, and pain signals to be recognized early. It reduces tearing, minimizes muscle strain, and helps preserve long-term comfort and health. Medically speaking, slow progression is not about delaying pleasure. It is about protecting the body and preventing avoidable injury through respect for its natural limits. Protection lowers the risk of sexually transmitted infections because it creates a physical barrier between bodily fluids, tissues, and microorganisms that can cause disease. From a medical perspective, sexually transmitted infections are spread when bacteria, viruses, or parasites pass from one person to another through direct contact with mucous membranes, blood, semen, or other bodily fluids. When protection is used correctly and consistently, this pathway is significantly disrupted. The rectal lining is particularly vulnerable to infections. It is thin, delicate, and highly efficient at absorbing substances. While this characteristic serves normal bodily functions, it also means that viruses and bacteria can enter the bloodstream more easily if exposed. Even very small, invisible tears in the tissue can act as direct entry points. Protection helps shield this sensitive lining from direct contact, reducing the likelihood that infectious organisms will reach vulnerable tissue. Another important factor is that some infections can be transmitted even without visible symptoms. A person may feel healthy and have no outward signs of infection, yet still carry and transmit viruses or bacteria. This is why relying on appearance or assumptions about a partner's health is medically unsafe. Protection provides a consistent level of safety regardless of whether symptoms are present. Protection also helps reduce the risk of infection transmission in situations where micro-injuries occur. Friction, pressure, or stretching can cause tiny breaks in tissue that are not immediately noticeable. These micro-injuries increase susceptibility to infection because they compromise the body's natural barrier. By acting as a layer between partners, protection reduces direct exposure even if minor tissue damage occurs. From a public health standpoint, consistent use of protection has been shown to reduce the spread of many sexually transmitted infections. While no method offers absolute protection, the reduction in risk is substantial. This is especially important in activities where the chance of exposure is higher due to tissue sensitivity and fluid contact. Lowering risk does not mean eliminating responsibility. It means actively taking steps to protect long-term health. Protection also plays a role in preventing the transfer of bacteria between different parts of the body. Certain bacteria are harmless in one area but can cause infection if introduced elsewhere. Using protection helps prevent this cross-contamination. Supporting overall genital and urinary health, proper use is essential for effectiveness. Protection must be intact, correctly applied, and used consistently from start to finish. Incorrect or inconsistent use significantly reduces its protective benefit. From a medical perspective, partial use offers partial protection at best. Consistency is key to reducing infection risk. it is also important to understand that protection is a shared responsibility. Infection prevention works best when all involved parties prioritize safety. Open communication about protection use supports informed decision-making and reduces misunderstandings that could lead to health risks. This communication is not just a social consideration, it is a practical health measure. Finally, protection supports peace of mind. Anxiety about potential infection can lead to tension, rushed behavior, or ignoring warning signs such as pain. When protection is used, individuals are more likely to feel secure, remain relaxed, and respond appropriately to their body's signals. This indirect benefit further reduces the likelihood of injury and infection. In medical terms, protection works by preserving the body's natural defenses, minimizing exposure to infectious agents, and reducing the consequences of unavoidable risks. It is not about fear or restriction, but about informed prevention. By lowering the risk of sexually transmitted infections, protection supports both immediate safety and long-term sexual health, making it a fundamental component of responsible sexual behavior. Hygiene matters, but over-cleaning can be harmful because the body relies on a natural balance to protect itself from irritation and infection. From a medical perspective, cleanliness supports comfort and reduces exposure to unwanted bacteria, but excessive or aggressive cleaning can damage delicate tissues and disrupt the body's built-in defenses. Understanding this balance is essential for maintaining long-term health. The anal and rectal area naturally contains bacteria that are part of normal bodily function. These bacteria are not inherently dangerous when they remain where they belong. Problems arise when harsh cleaning methods strip away protective layers of tissue or upset the natural environment. The lining of the anus is thin and sensitive, and repeated scrubbing, strong soaps, or internal washing can cause irritation and microtears. These small injuries increase discomfort and create openings through which infections can enter. Many people assume that the cleaner an area is, the safer it becomes, but medically this is not always true. Overcleaning can dry out the tissue, making it more prone to cracking and inflammation. Dry or irritated tissue loses its ability to act as a strong barrier against bacteria and viruses. In this state, even minor friction can cause damage that would not otherwise occur. What begins as an attempt to improve hygiene may actually increase the risk of injury and infection. Another concern is the use of harsh products. Strong soaps, antiseptics, or fragrance cleaners can disrupt the natural pH balance of the area. This imbalance weakens the tissue and may kill beneficial bacteria that help prevent the overgrowth of harmful organisms. Medically, maintaining the body's natural environment is often more protective than trying to sterilize it. Internal cleaning methods are another common issue. The rectum is self-cleaning by nature, and routine internal washing is generally unnecessary. Frequent internal cleaning can irritate the lining, increase sensitivity, and lead to inflammation. It may also interfere with normal bowel function. From a health standpoint, gentle external cleaning is usually sufficient. Hygiene should focus on moderation. Gentle cleansing with mild, non-irritating products and warm water supports cleanliness without causing harm. The goal is to reduce surface contaminants, not to remove every trace of natural bacteria. This balanced approach protects tissue integrity and reduces the likelihood of complications. Overcleaning can also create a false sense of security. Even with extensive cleaning, bacteria cannot be completely eliminated, and attempting to do so can lead to unnecessary stress and harmful practices. Medical safety relies more on protective measures and healthy tissue than on excessive cleaning routines. Pain, burning, or persistent itching after cleaning are signs that the area may be irritated. These symptoms should not be ignored, as they indicate that the tissue barrier has been compromised. Reducing the intensity or frequency of cleaning often allows the tissue to heal and restore its natural defenses. In summary, hygiene is important for comfort and general health, but more is not always better. Gentle, reasonable cleaning, supports the body's natural protection, while aggressive or excessive cleaning can weaken tissue, increase irritation, and raise infection risk. Medical safety comes from respecting the body's natural balance, understanding its limits, and choosing practices that protect rather than harm. Pain is a warning sign and should never be ignored because it is the body's primary way of signaling that something is wrong. From a medical perspective, pain is not an obstacle to push through, but a protective response designed to prevent injury. When pain occurs during any physical activity, especially one involving sensitive tissue, it indicates that the body is experiencing stress, damage, or conditions that could lead to harm if continued. In areas with delicate anatomy, pain often appears before serious injury develops. This early warning gives the body a chance to stop further damage. Ignoring pain can turn minor irritation into significant injury. For example, discomfort may signal excessive friction, inadequate lubrication, muscle resistance, or tissue stretching beyond safe limits. Continuing despite these signals increases the likelihood of tearing, inflammation, and prolonged soreness. The nervous system plays a critical role here. Sensitive nerve endings detect pressure, stretching, and irritation, sending pain signals to the brain when limits are exceeded. This response is immediate and purposeful. When pain is dismissed, the protective function of the nervous system is overridden, allowing damage to occur unchecked. Medically, this is similar to ignoring pain in a joint or muscle, which often results in strains or tears that take much longer to heal. Pain is also closely linked to muscle response. When discomfort is present, muscles naturally tighten to protect the area. This tension increases resistance and friction, making injury more likely. Pushing through pain creates a cycle in which tension leads to more pain, and more pain leads to greater injury. Stopping and allowing the body to relax breaks this cycle and reduces harm. Another important factor is tissue integrity. Pain often signals that the tissue barrier is under stress. When tissue becomes irritated or begins to tear, it loses its ability to protect against bacteria and viruses. Ignoring pain increases the chance that small injuries will worsen, creating openings for infection. From a medical standpoint, many infections begin not with visible wounds, but with tiny injuries that were overlooked because discomfort was ignored. Pain should also be considered in terms of recovery. Continuing an activity that causes pain prolongs healing time and may lead to chronic sensitivity or inflammation. What could have been a short period of rest and recovery can turn into days or weeks of discomfort. In some cases, repeated injury may contribute to long-term issues such as persistent pain or reduced function. Psychological factors matter as well. Anxiety, pressure, or fear of disappointing a partner can cause individuals to ignore pain signals. However, stress increases muscle tension and reduces the body's ability to adapt safely. From a health perspective, emotional pressure does not eliminate physical limits. Respecting pain supports both physical safety and mental well-being. Pain that persists after the activity is especially important. Ongoing soreness, sharp pain, bleeding, or discomfort during normal movements are signs that injury may have occurred. These symptoms should not be dismissed as normal. Medical evaluation may be necessary to prevent complications and ensure proper healing. In essence, pain is not a weakness or failure, it is information. It provides real-time feedback about what the body can safely tolerate. Listening to pain allows adjustments to be made before serious damage occurs. Ignoring it removes an essential layer of protection. From a medical standpoint, safety is built on awareness and response. Pain is the body's alarm system, and alarms exist for a reason. Respecting pain, stopping when it occurs, and addressing its cause are fundamental steps in preventing injury, infection, and long-term harm while protecting overall health. Aftercare supports healing and long-term health because what happens after physical stress is just as important as what happens during it. From a medical perspective, the body requires time, rest, and proper conditions to repair tissue, calm inflammation, and restore normal function. Ignoring aftercare can allow minor irritation or injury to worsen, while appropriate care helps the body recover efficiently and reduces the risk of long-term problems. Sensitive tissues can experience temporary stress even when precautions are taken. Mild soreness, sensitivity, or tightness may occur due to stretching or friction. Aftercare allows these tissues to relax and return to their normal state. Simple measures such as rest, gentle hygiene, and avoiding additional strain give the body the opportunity to heal naturally. When the area is repeatedly stressed without recovery time, healing is delayed and discomfort can become persistent. Blood flow plays a crucial role in recovery. After physical activity, the body directs blood to stressed areas to deliver oxygen and nutrients needed for repair. Relaxation and comfort support this process. When the body remains tense or stressed, blood flow may be restricted, slowing healing. Aftercare that promotes relaxation helps restore circulation and encourages tissue repair. Inflammation is another important factor. Some inflammation is a normal response to physical stress, but excessive or prolonged inflammation can cause pain and damage surrounding tissue. Aftercare practices that reduce irritation, such as avoiding harsh products or unnecessary pressure, help limit inflammation. This allows the body's natural healing processes to function without interference. Aftercare also helps protect the tissue barrier. The skin and lining act as a defense against bacteria and viruses. If this barrier has been stressed or slightly damaged, it needs time to rebuild. Proper aftercare reduces the risk of infection by keeping the area calm, clean, and free from additional irritation. Ignoring aftercare increases the chance that small injuries will become entry points for infection. Awareness during the recovery period is equally important. Aftercare includes paying attention to how the body feels in the hours and days that follow. Persistent pain, bleeding, swelling, or unusual discharge are not normal recovery signs and may indicate injury or infection. Recognizing these signals early allows timely medical attention, preventing complications and supporting faster recovery. Long-term health depends on cumulative care. Repeated physical stress without adequate recovery can lead to chronic irritation, sensitivity, or muscle issues over time. Aftercare helps break this cycle by ensuring that the body is fully healed before being stressed again. This approach preserves tissue strength and elasticity, reducing the likelihood of long-term discomfort. Mental and emotional aspects also influence physical healing. Feeling safe, relaxed, and cared for reduces stress hormones that can interfere with recovery. Aftercare that includes reassurance and comfort supports the mind-body connection, which is well recognized in medicine. When the body feels calm, it heals more effectively. Aftercare is not about reacting to injury. It is about preventing future problems. Even when no immediate pain is present, gentle recovery practices maintain tissue health and resilience. This proactive approach reduces cumulative damage and supports overall well-being. In medical terms, healing is a process, not an instant event. Aftercare provides the conditions the body needs to repair itself, restore balance, and maintain long-term health. By valuing recovery as much as activity, individuals protect their bodies, reduce preventable complications, and support sustainable physical health over time. Honest communication and consent are medically important because they directly influence physical safety, injury prevention, and overall health outcomes. From a medical perspective, many injuries and complications occur not due to lack of knowledge about the body, but due to misunderstandings, unspoken discomfort, or pressure that leads individuals to ignore warning signs. Clear communication and genuine consent act as protective factors that reduce these risks. Consent ensures that all participants are mentally prepared and willing, which has a direct effect on the body's physical response. When a person feels pressured, uncertain, or unsafe, the body responds with tension. Muscles tighten, breathing becomes shallow, and stress hormones increase. This physiological stress reduces the body's ability to relax and adapt, making injury more likely. In contrast, when consent is clear and freely given, the body is more relaxed, allowing muscles to respond naturally and safely. Honest communication allows individuals to express limits, discomfort, and needs in real time. From a medical standpoint, this is essential because pain, dryness, or tension are warning signs that require immediate adjustment or stopping. If someone feels unable to speak up, these signals may be ignored, increasing the risk of tearing, muscle strain, or prolonged soreness. Communication creates space for these signals to be acknowledged and addressed before harm occurs. Consent is not a one-time event. It is an ongoing process. The body's tolerance can change due to fatigue, stress, health conditions, or previous injury. Medical safety depends on recognizing that what felt comfortable at one moment may not feel the same later. Ongoing consent allows adjustments to be made as the body responds, reducing the chance of injury. Trust is another important medical factor. When individuals trust that their boundaries will be respected, anxiety decreases. Lower anxiety leads to reduced muscle tension and improved circulation, both of which support comfort and tissue resilience. Fear or uncertainty, on the other hand, can cause involuntary muscle tightening, increasing friction and the likelihood of injury. Trust, built through honest communication, supports the body's natural protective mechanisms. Communication also supports infection prevention. Discussing protection, hygiene, and health status allows informed decisions that reduce risk. Avoiding these conversations does not eliminate risk, it increases it. Medically, prevention relies on transparency rather than assumptions. Clear communication enables safer choices that protect long-term health. Emotional well-being and physical health are closely connected. Stress and emotional discomfort can weaken the immune response and slow healing. When consent is compromised or communication is lacking, emotional distress may follow, which can contribute to ongoing physical symptoms such as pain or sensitivity. Respectful communication supports both mental and physical recovery. Another medical consideration is the recognition of delayed symptoms. Honest communication encourages individuals to share concerns even after the activity has ended. Pain, bleeding, or unusual discomfort may appear hours or days later. Feeling comfortable discussing these symptoms increases the likelihood of seeking timely medical care, preventing complications. From a healthcare perspective, consent and communication are foundational to patient safety in any medical procedure. The same principles apply to intimate activities. Clear agreement, the ability to stop at any time, and open dialogue are not just ethical concepts, they are practical tools that protect the body. In summary, honest communication and consent reduce physical injury, support muscle relaxation, prevent ignored warning signs, lower infection risk, and promote emotional well-being. Medically speaking, safety depends not only on anatomy and technique, but also on psychological readiness and mutual respect. When communication is open and consent is clear, the body is better protected, healing is supported, and long-term health is preserved. If you enjoyed this video, make sure to subscribe to my channel, give it a like, and click the bell icon so you never miss a new upload. Don't forget to share it with your friends. Thank you so much.